There's a few things that we need to be doing better in the university sector around looking after young people with mental ill health. The first thing is to be able to understand the level of need that there is among students, and I don't think that we're doing that very well at the moment. So capturing that level of need. Once we've captured the level of need, it's important to think about the kind of response we have to that need. So looking at the services and supports that are available, working closely with local, particularly youth mental health services, things like Headspace, if they exist, and doing what can be done to support people to continue through their education and to complete and hopefully go on to have good careers. It's the reason why people have gone to university in the first place, and I think if we can be doing everything we can to ensure that they end up achieving the goals that they had in going there, it's an important part of what we should be offering. We know that in the general community, around about a quarter of young people at some point or other are going to experience mental ill health. And we know that there's a lot of drivers for students which are likely to mean that they're at slightly more risk than the general community. So while there are services in place at the moment, the question is, do they have the skills and the resources that they need to be able to do the job? And at the moment, the evidence would seem to suggest that perhaps they don't. Young people who have already got an experience of mental ill health very much want to continue to study and want to have jobs and careers, and that we have the beginnings of some evidence about how we can make that happen for them. But in order for that to happen, we need to really have the mental health system, which they might be accessing, and the educational system, whether it's secondary or tertiary, working much more closely together than they are at the moment, to basically have a coordinated approach to supporting the young person through their educational goals, and hopefully onwards then to whatever vocational pursuits they go after that. There needs to be clear guidance about things like special consideration so that people aren't disadvantaged by their mental ill health, but neither are they advantaged by it as well. And that needs to be clear and transparent so that academics can make appropriate choices, for example, when they're marking essays or considering special consideration. I would say that the other thing that needs to be done, and of course this is more taking a sort of a holistic view of things, is that universities are often stressful places to work, and I think that we need to have a recognition of that and some consideration for the mental health and well-being of university employees, whether they're academics or other staff working in universities, because they can be very stressful places and there can be high demands on the staff in those places. So I think making sure that, as well as looking after the mental health of young people who might be students, or sometimes less young people who are students, that universities are creating an environment which just values mental health of all the people who are in that environment.